I will then incorporate my drug delivery system inside of the chip, and this way I can have a model that will mimic what happens in the eye, because in the eye is not static. We have aqueous humor that is continuously being drained, and I could not achieve this on a static model because the drug released will always stay there. So in this case, I'm using an open system in which I have fresh media always perfusing through the chip, and then I collect the media on the other side. Hello, my name is Alexandra Oliveira. I'm a PhD student at Nova Medical School in Lisbon, and I'm studying a drug delivery system to overcome post-surgical complications in glaucoma patients. And I'm also interested in having a more physiological model, and for that I'm using a microfluidic setup. Glaucoma is one of the leading causes of blindness worldwide, and even though there are surgical treatments, and in this case I'm focusing on the glaucoma drainage devices, they often fail due to excessive fibroblast proliferation or excessive fibrosis after the surgical intervention. And right now, what doctors do is that they apply antimitotic directly into the surgery site, and this is not very standardized across all countries or even just in Europe. And even with this, because it's not prolonged in time, often surgeries fail. And my motivation was to try to develop a drug delivery system that will overcome this problem and reduce the rate of failure of these surgeries. We use a technique called layer by layer, which is basically characterized by the sequential adsorption of oppositely charged layers. In this case, we use PBAA as a hydrolyzable polymer to allow for the later release of the drug. We complex our drug with beta-cyclodextrin to allow for inclusion on the drug delivery system, and we also studied that this does not affect the biocompatibility or bioavailability of the drug, which is good. And we're also exploring the inclusion of graphene oxide as a barrier layer to try and release and control our release across time. As for my microfluidic setup, what we're trying to do is we're working closely with the Dynamic 42 to develop special and customized chips that will allow me to seed my cells, and after the cells are established, I will then incorporate my drug delivery system inside of the chip. And this way I can have a model that will mimic what happens in the eye, because in the eye is not static. We have aqueous humor that is continuously being drained, and I could not achieve this on a static model because the drug released will always stay there. So in this case I'm using an open system in which I have fresh media always perfusing through the chip, and then I collect the media on the other side. My most important and interesting results of this study is first that we were able to achieve linear growth in the films. We can see that they grow in a linear manner and that their variability is quite low, and agreeing with the literature, of course we're going to have always some variability, but we can reliably produce them. And we can see that with each adsorbed layer we can increase the load of the drug in the film. It's also very important to note that in the films without the graphene oxide, there's a burst release and then they completely plateau. As with the films with the graphene oxide, you can see even though there is a burst release at first, you can see that they still release drug across time. We are still working to improve this architecture to make sure that we keep releasing the drug throughout all the time we need, and we can achieve this by changing the number of layers and the number of barrier layers. So this is very promising, and we're still working on that. And then as for the microfluidic part, we first optimized all the coatings, and once we found the one that works best, which in this case for us was polyal ornithine combined with fibronectin, we then went directly for our microfluidic setup, and we were able to achieve a growth and a perfusion up to 14 days. As of now, we are still, again, running these experiments, and we can see after this time that our cells maintain their identity. So this tells us that they are still the fibroblasts that we isolated first from patients, and the caspase-3 indicator tells us that there is no cell death. So we are able to maintain our system flowing without the cells dying or detaching. And for the next part, we are then trying to include our drug delivery system directly onto the chip and trying to assess how the cells will react to it. First, you have in mind the scientific question you want to achieve. So what are the results and outputs you want to get from this system? Because it's very easy to get intricate in the engineering of it and wanting to do more and wanting to increase complexity. But first of all, you need to start slow. You need to have your cells very well characterized in a static setup, because if everything changes when you put them on a fluidic setup and you don't have them well characterized, then you don't know what you're expecting or what you are looking for. And it's very important that you know exactly where you want to go and the output you want to get, so you can design your system in the best way possible and achieve the best results possible. So that would be my main advice. Start slow, and then once you have one part of it set up, optimized, then you can increase complexity. And this is like kind of 2 steps, and in the end you will achieve the result you expect.